Morning everyone. So today we're going to talk about ankles, but first of all what I wanted to do is, I know it's Thursday, so it's Thank the NHS Day, and I know I'm a physio but I'm not in the NHS, so I just wanted to do a big shout out to all my friends and colleagues that are working out there, and you're doing an amazing job, and you know, we just want to say thank you. So today we're going to talk about ankles a bit. We talked about knees yesterday, and I was going to talk a little bit about acute knees, but we never really got to that. So I'll go into acute injuries a little bit more next week, but wanted to sort of talk about ankles because I think there's lots and lots of you out there who are running on different terrain than you would normally run on. It's not muddy, the actual, you know, we've got completely different challenges than we had a couple of months ago. No mud, hard ground, and actually, you know, if you're used to running on the road and the flat surfaces, then, you know, all of a sudden you're challenging your ankles and your stability because we're now running on uneven, hard ground, you know, and if you go across the fields, and to be honest with you, it's actually nicer going across the fields because there's not as many people. You know, if you're on the road, you're weaving all over the place, and we are probably a little bit more likely to go over on our ankles at this time of the year than perhaps we would, you know, if we're just doing our normal road running. So how do you know if you've gone over on your ankle? Oh, first of all, it hurts. You know, first of all, you feel your ankle go and it hurts. And, you know, I think the things to look out for is, you know, a loud noise, immediate pain, can you weight bear? If you can't weight bear, you know, you can't sort of stand up, put your weight in it, and you feel sort of really sick and you know, and it's acutely painful, then, you know, that's the time where you sort of think, well, have I done a bit more than a sprain? Do I need to get an x-ray? Get yourself home, and you know, you can have a little, you know, have a little look at it and feel it. If it's ballooned up immediately and you can't put your foot down, then I think that is an indication that you might need an x-ray. However, if you can put your foot down, or here comes a dog, if you can put your foot down and you can, you know, you can weight bear, then, you know, we're probably looking at a sprain. And if there's, you know, swelling that's come up straight away, the first thing you've got to do is, you know, we still use RICE, so, you know, your rest, ice, compression and elevation. Go over there. Then, you know, so get off it. So the first thing to do is, if you sprained your ankle, is get off it as much as you can, and for the next 48 hours rest it. Okay, try not to put your weight through it because we don't want that to get worse. Okay, we don't want you to sort of damage more ligaments and encourage more bleeding. Our initial phase in the first 48 hours is to limit the bleeding. If you can get a compression bandage on it, that will help. Not too tight that it cuts off the circulation. You have got your toes to sort of that you can check there, and if you can, just keep it elevated. You know, just you know, as much as you can for those first 48 hours. Just keep it up, rested, and just keep the weight off it. Okay. Sorry, I've got a dog that wants to go out. Quick, come on. That's it. This is what comes from working from home. So once you've got through the first 48 hours and you think, right, okay, what do I do? It's a bit like all the things we've been talking about. If you've injured something, it will be weak. Okay, if you've sprained your ankle, you will have torn ligaments. Those ligaments will need time to heal. They will need at least 10 days to 2 weeks to heal, right? Okay, because you know, you will have torn something. It's not a biomechanical overuse injury. Something has actually got to heal. And if it's a bad sprain, it can take 4 to 6 weeks. It doesn't mean you're not going to be running for 4 to 6 weeks, but it can take 4 to 6 weeks before it's actually better and you feel comfortable on it. You could just do a little bit of easy stuff in the meantime, but it's just all about not stressing those ligaments. If you go over on it again, and do the same thing again, it will be a lot worse. So if something's weak, something's been damaged, we've got to gradually load it, and it's back to the same principles that we've talked all the way through. Start very gently. You know, if you've gone over on your ankle, you know, you really just want to start just doing a little bit of working, sitting, just getting a little bit of weight through it. Okay, and then, you know, you want to mobilize it. You want to just try and just get a little bit of movement back in it. You know, one way and then the other way. Okay. And you know, invariably, if you've sprained your ankle, you know, it's highly likely that you sprain the ligaments down here the ligaments that connect the fibula to the foot. And it's normal that you do an inversion injury, and that's normally the ligaments that go. And you know, you can palpate down the fibula and think, oh, actually, that's acutely painful. You know, if you've got a little bit of the bone or a little bit at the bottom that's acutely painful, then you know you've just got to start thinking, what have I actually done? So really, it's the same loading principles. You know, sitting, getting it moving, sitting, keep using your eyes, lots of balance work, lots of two-legged calf raises first, and sort of going, you know, just building it up as we have talked about in all of the other videos. But what else can go wrong with the foot and ankle? Okay, so we've got the foot. Show you on this one rather than my foot. Okay, if you've got a pain in the foot, right, and it's somewhere in this area. So if we look at the foot, somewhere, you know, in that midfoot along those toes, have a feel, okay? What are you feeling? There's not a lot else in there on the top of that foot other than those bones, okay? If it's acutely painful, and it's painful when you're running, and it gets worse when you're running, and it aches at rest, you might have to start thinking, have I got a stress fracture in one of those metatarsals, okay? We're doing more running, more walking, more time on the feet. You know, it's quite a sort of, you know, key time for those sorts of things to happen. Then you've got your, you know, your smaller bones here. You've got your navicular and your talus. You know, you don't want a navicular stress fracture. That's the sort of bone in there. They take a long time to heal. And that's if you get a pain. So come back a bit. And it's acutely painful to palpate in there. And again, you know, pain to hop, pain at night, worse pain when you're running. These are just things that you just got to think about, should I actually be carrying on? And if you're not sure, you know, there's loads of us are not working at the moment, just email somebody that you know and trust. We've talked about plantar fascia, comes from the heel through to the toes. And then a couple of things I wanted to talk about. You can get pain that runs along the back of the fibula and underneath, and that's your peroneal tendons, okay? So that's the muscles that actually help you with your stability and sort of turn the foot out like that and just keep that ankle a little bit stronger. If you've suddenly done lots and lots of sort of uneven work, you can get a little bit of tendinitis around there. So you can get the pain, here we go, the pain round the ankle down here. However, the muscle belly is up here, so it's at the back of the fibula in this area here. So you can actually just feel, you know, down that muscle and think, oh, that's really tight. And just use your thumbs, just release it a little bit, you know. And you know, the head of the fibula is there, and just have a little press of it and just think, oh, that actually really hurts. Okay, and then think, okay, well let me mobilise the other side. And the head of the fibula is, it's the bony bit. If you come down your IT band, it's the bony bit that you just feel on the outside. And just think, gosh, that one hurts and that one doesn't. I've got a bit of pain on the outside of the ankle. Maybe I just need to get that moving a little bit. You know, if you can't lift your feet up properly and there's a little bit of stiffness at the head of that fibula, then, you know, that's what's going on. So you know, just little things like that. The other common area to get a bit of tendinitis is in your tib post tendon, and that comes under the inside of the medial malleolus. So the inside of the foot, and just runs under the foot there. And again, same thing, you know, lots and lots of uneven running, just more running, stiff foot. You know, if your foot's stiff and it's not moving, then, you know, this tendon's got to work a lot harder. If you're tight in your calf and you can't bend that way, then these muscles have got to work a lot harder as well, just to take your foot forward. And again, the tendon is under the foot, but the muscle belly is in the inside of the calf. So, you know, you've got these sort of odd pains on the inside or the outside of the ankle. Have a little feel down those muscles and just see what's going on. And of course, you know, if you've got foot pain, calf pain, always go up to your lower back. Is your lower back a bit stiff? Are the nerves that are coming from the lower back a bit tight? So, you know, you could go down, you could put one foot in the air and think, oh, actually, I can't move that foot. Or then do that one and think, oh, it's much, much tighter in that position. You know, and check it in a normal position and think, yeah, it moves okay. And then you've got to think, okay, well, maybe my nerves are a little bit tight. And then you think, right, let's just do some rotation stretches for my lower back, get my core a bit stronger, take the pressure off my feet. So we've got, and I think, just think about, why is the foot weak? Strengthen it up. Where is the pain? Where is the pain and why is it tight, okay? If it's an acute pain, don't forget, there could be a stress fracture going on in these metatarsals. That's, and unfortunately, if you have that, there's only one thing you can do is rest. Rest from impact. You can get on your bike, you can do all your sort of weight-bearing exercises, but no impact, no jumping. Tendinitis, you can run. What I would do is back off a little bit, go back to sort of more of a flat surface, but release those muscles. And if there is pain the next day, and it's worse pain the next day, then you've done too much. So, you need to back right off. And it's okay to find that balance between running and not running, but you need to be doing little enough that you're not making things worse, okay? So hopefully that covers all things in the foot. Sprained ankle, rise, rest, ice, compression, elevation. The most important thing with a sprained ankle is to give it that 48 hours to heal. Don't take anti-inflammatories because you want that healing process in the first 48 hours. And it's the same year with knees and things like that. If you've done any acute injury, give it that first 48 hours grace just to let the clotting factors happen, let the scars start to form inside. It's a bit like if you've cut your arm. You don't want to keep opening it up in the first 48 hours because it will just keep bleeding. Well, the same thing is really happening inside. So if you can rest things for the first 48 hours, that makes a massive difference. Okay, so tomorrow, Fun Day Friday, we're going to do a bit of balance work, which will follow on nicely from the foot and ankle and the knee. Hope you have a great day in the sunshine.